Chapter 40 Liver, Gallbladder, and Pancreatic Disorders. Liver is the largest internal organ in the body, and we use the word hepatic that refers to the liver. Anatomy and physiology of the liver. It's divided into 4 lobes made up by many lobules, and the blood from the aorta delivered to the liver via the hepatic artery. Bilirubin is the product of the normal breakdown of old red blood cells in the liver, and bile is the one that's produced in the liver, passes through the cystic duct, and stays in the gallbladder for storage. Then when fats pass into the duodenum, the gallbladder and the liver respond by delivering that bile through the common bile duct into the small intestine to emulsify the fat. Metabolism of glucose also happens in the liver. Glycogenesis is when we eat a meal, that excess glucose will be stored in the liver as glycogen. Glycogenolysis is when the blood glucose level falls, then the glucose molecules are returned to the blood. Glyconeogenesis is when the fats and protein broke down in response to low blood glucose level and molecules are used to make new glucose. Protein metabolism has been covered in previous chapter. Lipid metabolism also have been covered. Blood coagulation, this happens in the liver when there's say two elements for coagulation, the prothrombin and fibrinogen. They are both synthesized by the liver, and this prothrombin and fibrinogen, it helps with coagulating the blood, so like helping with preventing the bleeding. Detoxification, the liver also filters the blood. When it comes to immunity, the development of antibodies to resist pathogens are produced in the liver. Hormone metabolism, like adrenocortical hormones like estrogen, testosterone, and aldosterone, are metabolized. Health history, we'll pass this, and physical examination. So for lab studies, we will check the patient's liver function by checking the bilirubin level for one. Then we will check ammonia level, prothrombin time, INR, and then serum enzymes like the ALP, alkaline phosphatase, alanine aminotransferase, ALT, the GGT, SGPT, ALS, AST, SGOT, and LDH. We would also do like imaging studies like biliary scintigraphy, CT scan, MRI, or ultrasound, or if needed, we could do like a liver biopsy. Liver biopsy is when the specimen is obtained either from open biopsy, that is under general anesthesia, or needle biopsy, which is the use of a special needle inserted through the abdominal wall. Before the biopsy, we will do a baseline vital signs, and then we will do those blood testing, blood coagulation studies. Signed consent is needed, and then the surgeon will explain the procedure. During the procedure, the patient will be positioned supine with right arm behind the head with pad under the right chest. Okay. Sorry. I will highlight this because as nurses, this is part of our responsibilities to make sure that the patient is positioned properly. Patient will take a deep breath and holds it during the puncture. Sample of the liver tissue will be aspirated for study. After the procedure, there will be a pressure dressing over the puncture. We have to assess the site for bleeding and assess the vital signs per agency protocol. Checking for bleeding, for signs and symptoms of um, bleeding and hypovolemic shock, also signs and symptoms of infection. Fever is one to assess for systemic infection. Patient needs to stay, again, I will highlight because it's very important for us to remember it, but patient will stay on the right side for 2 hours to maintain the pressure um, on that area. So again, look at this picture, where's the liver? And so when we do that biopsy, they will insert that needle here, and then the puncture, so the puncture site will be on this side. So it makes sense that the patient will be laying down on the right side for at least 2 hours to kind of like put a pressure on that area, preventing um, bleeding. Okay, so in this picture, it's showing us the signs and symptoms that we will see when there is a problem with the liver. Skin, hematologic, metabolic, cardiovascular, reproductive, gastrointestinal, and then neurologic. So it's really based on which is affected. You will see these manifestations. Hepatitis is the inflammation of the liver, and there are types of hepatitis: A, B, C, D, E, and G. And GB are infectious, and non-infectious that are caused by exposure to toxic chemicals and drugs are the other hepatitis. Signs and symptoms we will see are rash, angioedema, which is like swelling under the skin, and then arthritis, fever, and malaise. Hepatitis A is transmitted via water, food, or equipment that is contaminated by infected fecal matter. Hepatitis B is transmitted via intimate contact by contaminated blood or from medical equipment, like if they're like sharing needles for like those drugs, or from infected mother to baby. Hepatitis B vaccine is available, and we usually recommend this for healthcare workers because the risk of exposure to contaminated blood is high. Hepatitis C is transmitted by contact with contaminated blood, medical equipment, or body fluids, or from infected mother to baby. D survives in presence of hepatitis B, transmitted percutaneously or following HBV infection. E is similar to hepatitis A. G is transmitted by blood transfusion, appears to exist only with other viral infection. And then those that are non-infectious hepatitis that could cause the inflammation of the liver, cause are not always identifiable, but results from exposure to toxins, alcohol, and acetaminophen um, could be the contributing factor. So for hepatitis, there are three phases. The first one is pre-icteric, and this one happens 1 to 21 days. This is when the patient are most infectious. And these are the signs and symptoms. In the second phase, which is the ecteric phase, 2 to 4 weeks, patient will have jaundice, light or clay-colored stools, and then dark urine. The post-ecteric phase lasts for maybe even several months, and then patient will have fatigue, malaise, and liver enlargements. Chronic hepatitis or a hepatitis that is not corrected can cause cirrhosis of the liver, liver cancer, and even severe liver failure. So to diagnose, we will do like detection of the pathogens, whatever pathogens it is that could be causing the inflammation of the liver, maybe a virus or other pathogens. We're going to check the antibodies in the blood, and then elevated level of the liver enzymes. So when we check the blood draw for liver enzymes, we will see elevated level of AST, ALT, and GGT. And the serum and urinary bilirubin will be elevated. Also, urinary urobilinogen from the urine will be elevated. Liver biopsy evaluates harm to liver. There is no cure. What we would do is to treat to promote healing and manage the symptoms. Antiviral drug can be used for some types of hepatitis. Antipyretics for fever, corticosteroids for the inflammation, and antiemetics if there is signs and symptoms like nausea and vomiting. Those medications that are toxic to the liver should not be given. Hepatotoxic medications should not be given. And then the diet will be high calorie, high carbohydrate, moderate to high protein, and moderate to low fat with supplementary vitamins. To prevent, again, hepatitis B vaccines are available. Okay. Patient teaching is the infected person should see provider immediately and do not share personal items or utensils, especially those hepatitis that are transmitted by infected fecal matter. So those may be like personal items that are infected because of the infected um, fecal matters is in there. Patients with active hepatitis should use condoms and do not expose others to blood. We would do a standard precaution, which is very good hand hygiene and hand washing. And we will also educate for the hepatitis B vaccinations, which are, by the way, 3 injections. Okay, 3 injections. So it's a series of 3 injections. If antibody titer is inadequate, up to 3 booster doses may be given for hepatitis B. Alcohol-induced liver disease are those liver disease that are caused by alcohol abuse, like fatty liver, alcoholic hepatitis, and alcoholic cirrhosis. So cirrhosis is a chronic progressive disease and is a degeneration and destruction of the liver cells. There are types of cirrhosis based on what have contributed it. Alcoholic is with alcoholic liver disease. Post-necrotic is post-necrotic that can be a complication of hepatitis. Biliary develops as a result of obstruction to bile flow, and cardiac follows severe right-sided heart failure. Signs and symptoms of cirrhosis also differs based on which stage they are in. So for early cirrhosis, these are the signs and symptoms. Progresses also, these are the signs and symptoms, and then later is um, These are the signs and symptoms. Complications could be portal hypertension, esophageal varices, ascites, and hepatic encephalopathy. To diagnose, we'll do a history and physical examination, and then the liver function test again, and then liver biopsy. So this is the ascites. So we would see where the fluid accumulates here in the abdominal cavity. Um, to correct this, well, what we would do is the patient will have to have what we call paracentesis, where they would insert that needle and aspirate the fluid that is in this abdomen. You can just imagine how uncomfortable this could be for the patient. It will be hard for them to sleep, walk, maybe even eat, breathe, right? So that's why patients going to need the paracentesis whenever it gets too big like this. Esophageal varices are those like varices in the esophagus. So if you look at this vessel is dilated. Um, and then for the portal hypertension, so when the liver is is diseased like this, like there's a disease of the liver, then the portal vein and the portal circulation are also in affected. Okay, again, medical treatment for cirrhosis: bed rest, diet that's high in carbohydrates and vitamins, IV fluids, anemia that may require blood transfusion, water and sodium likely to be restricted, and cathartics like laxatives, and antibiotics for hepatic encephalopathy. This one, if you recall the lactulose, right? Lactulose is to lower down the ammonia level. Patient will be um, defecating, or there will be an increase defecation. They would poop a lot. So again, this is similar to a laxatives, and the ammonia will be secreted by increasing the defecation of the patient. Ascites, we did talk about, they will have a paracentesis, or they will need a paracentesis to help them manage the ascites. It looks like this. So the ascites, the enlarged abdomen that we were looking at earlier on, is because of this abdominal cavity here that is filled with fluid. So what we would do for ascites is that we would do a paracentesis. It's called paracentesis, where this needle is inserted into the peritoneal space and kind of like drains the fluid into this bottle right here. Um, Again, this one is indicated when the acidic fluid interferes with the daily life, including the breathing. Before we start, we would do a written consent, baseline vital signs, weight, and then abdominal girth, checking the abdominal girth. Um, what we would do for checking the abdominal girth right here is that we would use a tape measure, and we would measure the patient's the circumference of the patient's abdomen, and this should be done every morning before the patient would eat, and we would use the same tape measure every single time. And when there is an increase of the abdominal girth, then that's the time for the patient to go to a paracentesis. Okay. Patient will be instructed to void prior to the procedure to avoid the accidental poking of the bladder. And then patient will be in a sitting position. Usually 2 to 3 liters of fluids are removed slowly. We as nurses need to um, apply sterile dressing to the puncture site, and then we will monitor vital signs, dressing check per agency protocol, measuring fluid obtained, send for analysis, and monitor for blood in the urine. We did discuss the lactulose for the hepatic encephalopathy, daily measurement of weight intake and output in the abdominal girth. A patient that has end-stage liver disease, maybe from injury or chronic disease, or could be from acute hepatitis, drug toxicity, or obstruction of the hepatic vein. Cancer of the liver rarely begins in the liver, but usually is a frequent site of metastasis. Cirrhosis is a predisposing factors. And these are the signs and symptoms. We would do like a CAT scan or MRI, liver scan, and biopsy to confirm diagnosis. If the cancer is confined to one area, a lobectomy may be done, which is the removal of a lobe of the liver. Otherwise, chemotherapy is the primary treatment. Patients that have liver disease or end-stage liver disease, the only cure would be liver transplantation. And they are, or the transplant list is ranked by acuity and need and entered into a national computer network. And when the liver becomes available, the best recipient will be picked and identified. Very important that the patient must remain sober, um, because part of the process for liver transplantation is to make sure that the liver that is being transplanted to a patient is going to be taken care of too, right? So it makes sense that the patient must remain sober. Patient will often has a T-tube. This is T-tube is for drainage, wound drainage. Also will have a nasogastric tube and a central line for TPN. And initially, we may even put them on mechanical ventilation. All right. For liver transplantation or any transplantation, lifelong drug therapy is needed to prevent the rejection. And then they must be monitored for signs of rejection. Bile is the yellow-green liquid that is essential for emulsification and digestion of fats. Also provides a medium for the excretion of bilirubin from the liver. Cholecystitis is the inflammation of the gallbladder, and this is usually caused by gallstones, but it can also be due to bacteria, toxic chemicals, tumors, anesthesia, starvation, and opioids. And also the cystic duct may be occluded that could cause the inflammation of the gallbladder. Like this. So this is the gallbladder and you will see like gallstones. And when it's blocked, like for example, this part right here is blocked, um, then the gallbladder will be inflamed, okay, and that will cause the cholecystitis. Now, the stones are called cholelithiasis. So, cholecystitis is the inflammation of the gallbladder, and cholelithiasis is gallstones. Okay, signs and symptoms are in this list, and complications from cholecystitis and cholelithiasis could be pancreatitis, abscesses, and cholangitis and rupture of the gallbladder. Medical treatment. So patient has an inflammation, so they will be in pain. We will give them an analgesics to help with the pain, antibiotics to treat bacterial infection, intravenous fluids, nasogastric tube could help. And then we will do this what we call shockwave lithotripsy. So shockwave lithotripsy is the use of those shocks, um, and it's kind of like shaking the stones and breaking it apart into small pieces. When that is done, patients will be monitored for like those small stones that will be coming out to their urine. So one part of our education as nurses to the patient is that they will have to monitor, or we will monitor it for them also, kind of like strain their urine to see if those stones were broken apart and it's now out of the body. Cancer of the gallbladder are rare and thought to be related to chronic cholecystitis and cholelithiasis. Um, Treatments could be surgery, chemotherapy, radiation, but prognosis are generally poor. Pancreas is the fish-shaped organ located in the upper left quadrant of the abdomen behind the stomach. And it contains enzymes that is needed to digest proteins, fats, and carbohydrates. They are trypsin, amylase, and lipase. And the alpha cells produce and secrete glucagon, and beta cells produce and secrete insulin. Physical examination and diagnostic test procedures are the same with what we talked about in chapter 37. Pancreatitis is the inflammation of the pancreas, could be chronic or acute. And this could be caused by biliary tract disorders or alcoholism or viral infection, peptic ulcers diseases, metabolic disorders, trauma from external injury, surgery, or endoscopy. For pancreatitis, the enzymes, the trypsin, um, uh, pepsin, lipase, those enzymes from the pancreas that are helping with the digestive of proteins, fats, and carbohydrates are activated. And when that is activated, it digests the pancreatic tissues. And when that happens, then the pancreas will start being inflamed and then it will not be able to function properly. Signs and symptoms of pancreatitis. The most common one would be severe abdominal pain with sudden onset. And then it's centered in the upper left quadrant. or epigastric region and radiating. Oops, you can barely see that. Give me 1 second. Okay. And radiating to the back. So we have to remember this. This is a severe abdominal pain with sudden onset, and the location is in the upper left quadrant or maybe in the epigastric region that radiates to the back. More signs and symptoms. Okay, again, to diagnose this, we will check the pancreatic enzymes, the amylase, lipase, and they will be elevated. Also, elevated white blood cell count. If there's an infection, medical treatment, patient will be nothing by mouth. We will use a nasogastric tube, intravenous fluids, blood or plasma expanders. The urine output will be monitored, and it should be at least, well, it should be 30 ml per hour. Scratch that 40. Urine output usually is 30 ml per hour. Once food is permitted, usually bland, low fat, high carbohydrate, divided into frequent small meals. And then we will give prophylactic antibiotic. Cancer of the pancreas quickly spreads to the duodenum, stomach, spleen, and left adrenal gland. Risk factors are chronic pancreatitis and smoking, high-fat diet, exposure to toxic chemicals. These are the signs and symptoms. Same diagnosis as how we do it in GI situations or disorders. If the tumor is confined to head of the pancreas, surgery is an option. Post-operative radiation therapy and chemotherapy. Okay, after the um, surgery, post-operative nursing care would be closely monitoring vital signs, intake and output, glucose level. We're assessing the wound for bleeding, infection, wound separation, monitoring the patient for electrolyte imbalance, poor circulation, and hepatic or renal function. Blank is a product of the normal breakdown of old red blood cells in the liver. Answers bilirubin A. Hepatitis blank is transmitted from one person to another by way of water, food, or medical equipment that has been contaminated with infected fecal matter. Answer is A. Hepatitis A has been called infectious hepatitis and epidemic hepatitis. It is caused by the hepatitis A virus, which is transmitted from one person to another by way of water, food, or medical equipment that has been contaminated with infected fecal matter. And hepatitis A is the most common type of viral hepatitis.